This is MetroTalks.
Hello, this is MetroTalks, a series exploring the future of metropolitan spaces with urban thinkers. I'm Octavi de Varga, Secretary-General of Metropolis, and today we're looking on how metropolitan governance can promote healthy urban planning. As our metropolitan areas are still struggling with the COVID-19 pandemic, the need to tackle the urban health and well-being crisis has never been clearer. Our talk, MetroTalk today, is about how we can avoid the next health crisis in our urban spaces, or how we can integrate health and equity in planning, investment, and policy making. To help us to explore these issues, I'm talking today with Thiago Herick de Sa, a public health professional working on healthy urban environments and sustainable mobility at the World Health Organization. Hello, Thiago.
Hi, Octavi. It's a pleasure to be here. Thanks for the invite.
Our pleasure as well. And Elisabeth Belpaire, an urban spatial planner. She's member of the board and as well executive committee member of ISOCARP, the International Society of City and Regional Planners. Hello, Elisabeth.
Hello, Octavi. Thank you for having me, and thank you very much for raising this critical and very urgent topic.
Yeah, and in fact, I think it's the first time in Metropolis that we're having this kind of discussion and exchange of ideas, bringing on the table the issues of health and equity and in urban planning. So I think we are very excited to have both of you today here. So let's start maybe with the first question for our discussions. As you say, you both work on enabling the health of people as well whilst addressing inequalities. So in order to get a sense of the health and well-being benefits of strategic urban planning, how do you think how can metropolitan governance promote healthy urban planning in general, and not only in times of pandemic? Because, and this comes as well from one initiative we are developing with the London School of Economics on the governance of emergencies. And what we're looking is that cities are facing more and more complex emergencies, and it's not something that happens from time to time, but these kind of situations probably will be structural part of our cities. So how can you see which could be the contribution from the well-being perspective and health perspective in a strategic urban planning? Maybe you can start with Thiago.
Sure, Octavi. No, I think that the point you raise is very relevant, especially now that you just mentioned the COVID crisis we all face, and it is certain that this has served as a wake-up call for some, or a reminder for many of the importance of the environment for health and well-being. Yeah. There are many health and well-being benefits that we can harvest through strategic urban planning in a metropolitan context, and we have now clear evidence showing that compact cities where we have a diverse use of land, where the distances are short and people can now get by their daily activities with short distance and short time, cities that are accessible, they can certainly deliver a lot on health equity, which is an important dimension of that, and of well-being, of course, not to mention the multi-sectorial policies on transport, on public spaces, on energy, on housing, and many others. Now, there's also an important aspect for us to consider here, and I think that metropolitan governance is key to that, which is the fact that health is not only an outcome of a strategic urban planning, it's not just a consequence of that process, but it's also a fundamental input for strategic urban planning to be more efficient and successful. And this goes from the best use of the health data that exists that can serve for us to better understand the situation, also track progress. There are several health competencies that can be used as part of this process. And again, the metropolitan governance can allow this mainstreaming of health throughout the stages of the planning process to be maximized. Now, the communications and advocacy that health is familiar with, is very much familiar with. The health is usually a credible voice in a society, and this is not different in metropolitan areas. People listen to public health. People listen to their doctors and nurses. So this is an important asset that health can bring to this table. And one last point I would like to raise as well is that at the core of strategic urban planning we have the participation of people, and we have to ensure that all the voices are heard. And again, oftentimes we see that using health as this entry point and placing health and well-being at the core of this discussion is a way to give voice to those that usually don't have, the most vulnerable ones, the most marginalized ones in the process of developing and shaping our cities and our metropolitan areas.
So, Elisabeth, I'm building on what Thiago has said. I mean, he said that, well, he mentioned two things. One is public space, issues about public space, how we see public space, and also health as being a central part, not something additional, but a central part of urban planning. And in fact, maybe it's something we had forgotten, because we look back at the beginnings of early urbanism. What early urbanism? The ending of the 19th century, early 20th century. Urbanism started an issue about health and sanitation and how to have more healthier urban spaces. My feeling is that during the last years, we had a little bit forgotten of that, and we were only thinking about big infrastructures and making nice cities, but forgetting the part of health. Do you agree on that, or what do you think is the problem here?
Yes, health and urban planning, they have been natural allies for a long time, and that's also how urban planning started. But I'd like to go back to the COVID. We're all confronted with it, and it's a big health crisis. But I think we should absolutely not forget about climate change, because that's probably the most profound health threat and also an opportunity. And I think...
Sorry to interrupt, Elisabeth. I think that's a very good point, because, and what I was referring at the beginning about complex emergencies, that everything is interconnected.
Yes, it's all interconnected. And I think with the next coming months leading up to the COP26, it's absolutely crucial that we radically rethink and for whom and what our spaces are, including the public spaces, and that we really accelerate bold thinking and push the boundaries. If we go back to daily life, then we see that our environment in which we grow up, we live, we work, we move, we relax, we connect with each other, they impact our health and well-being. And in multiple ways, as mentioned by Thiago also, it can prevent diseases, it enables healthy lifestyles or not, it gives us access to healthy resources, air, healthy, clean water, green spaces, areas without violence, for instance, or not. And it can also provide healthy resources and enable people to have either access to healthy nutrition or not, or to health services, for instance. And so the way we plan and design these environments impact our health and well-being. And how can we do it? It's mentioned too, we have complex realities. The thing we are certain of is that there will be more uncertainties in the future. We also know that both climate and health, they're actually wicked issues, so we cannot solve them on our own, and so we need to collaborate with each other. And I think that's where especially strategic spatial planning comes in as a critical tool and a process at the metropolitan level, because it allows to integrate different issues in an envisioning process. It has an important track to engage stakeholders. It enables also to strategize with budgets and efforts on place-based interventions. And I think another aspect which is very important now too is that there could be a fourth track in this process, that is one of continued capacity building, learning, for instance, people learning about health, about the impact of the built environment, but also to allow individuals of different stakeholder groups to meet and to leverage new innovative methods like citizen science, like laboratories, experiments, and then feed into this planning process again.
And if you allow me, Octavi, just to react to 2 quick points from Elisabeth, which I think are really important. The first one, and I think that this is an essential contribution that metropolitan areas can offer, is the recognition that most of the health benefits lay outside the health sector. So you have to have this integration across the different sectors. And this is something that a metropolis can do. And it's at the core of the way metropolises are run and governed. Now, this convening power to bring together those that need to be in the table for us to harvest on health and well-being. And the second aspect related to capacity building, which I think is essential. And again, oftentimes what we see is that these dialogues do not happen simply because people are not prompted to. So this is an important aspect that Metropolis can contribute to as well. Not to mention the fact that cities like to learn from one another. There's no better evidence for cities than looking at what the other colleague did and seeing what and learning lessons from that. And again, now there's no better mechanism for doing that than within the metropolitan areas and across metropolitan areas across the globe.
Both your interventions made me thought about two different things. Maybe they are connected. One, Elisabeth, you said about the interconnection of different things, no? And then the pandemic has confronted us to the issue that public space was important. In some countries, in some cities, have forgotten that public space is where life takes place. No, even informal economy is where children play, is where things happen in the city, in the public space. But then we have discovered most of the houses didn't have the conditions for people to stay in. And we were telling people to lock down, to stay at home in houses where they were not prepared, were not well ventilated, for example, having 8 people living in a small house with no rooms and so on. Then we're talking about all the issues about health and sanitation, and the issue about sometimes with a global north perspective, like cleansing of hands when people they don't have access to clean water, how you do these kind of things. So on the one hand, we've seen that our cities were not prepared to all these things, and it comes and as you said, Thiago, health comes from different perspectives, from different areas. It's not, sometimes we tend to think in terms of medical health and not the health, public health and global health. And the other thing is about what you were saying, both of you, is where do we need to do the shift? I mean, I have a feeling that urban thinkers, you already are aware about all these things. Do you think political leaders of the cities are already aware about these things? Or where do we need to make the shift? Because you were talking, Elisabeth, as well about involving different actors, stakeholders, working together and making changes. But where do the shift needs to take place?
Yes. I think I'll illustrate it by an example. I think if we look, for instance, at Tirana is a very transformative example. And they have been looking at the metropolitan view from the perspective of a child. And the city has developed, in fact, over the past couple of years, a grand vision for 2030 for urban change by putting children at the center. So to turn the city to children. And they have done this by emphasizing public space and also mobility. What does it mean to turn and transform public spaces into play areas, green areas, to have attention for mobility, so small children are able to walk, to ride a bike, to learn to ride a bike, and to ensure long-term sustainability. They also at the management level, they have introduced the chief child officer in the management structure. So it means that at all times, the focus on children is being brought back across the sectors. And it allows also for budgeting to be oriented towards children and children health as a result. And recently we had a discussion with the Deputy Mayor Anuela Ristani about the COVID impact. And she was mentioning that these measures from the last 4 years, in fact, proved to be very efficient for during COVID period, because people came out in these new created public spaces. And that there was also an increase of elderly, for instance, families coming out. So these are elements that prove resilient, and that are actually elements of a livable and healthy city.
And do you think, Thiago, according to what Elisabeth said, that public space is the winner of the pandemic, rethinking public space, or which are all the other areas that we are rethinking because of the pandemic in terms of urban planning and health?
I would say that public spaces and the housing, as you mentioned, have never been as important as today. And both of them but also children, as Elisabeth just highlighted, can serve well as an entry point. That we do not have the resources, neither the time to tackle all these things one by one. So we have to have an integrated approach, right? And I think that by now we are all convinced that urban environments are essential for health and well-being, that we do have some successful experiences. Now, Elisabeth has just highlighted the experience of Tirana. We could talk about the success of the metropolitan areas in Japan in promoting walking and cycling, or the successes of the Latin American metropolis in addressing air pollution, another vision now by several European areas, now Paris, Barcelona, and rethinking the way we organize our cities. I guess the question and the challenge now, and we at WHO are obsessed with that, I would say, is precisely on how we do this. And let me tell you something that for me, it's quite interesting. Most of the times we suggest a policy or an intervention in a metropolitan area. Let's say we decide to expand the road network, or we decide to build a new bridge. We have to do, in most cases, an environmental impact assessment. Rightly so. It's important for us to consider the impacts, the unintended consequences in the environment. And this is not necessarily the case for health. We do not do a health impact assessment, which is a well-established tool that exists, for which we have capacity. We have experts, including planners, familiar with that, but this is not necessarily mainstreamed in the process. And I think that this is one important aspect. How do we make sure that health considerations are integrated in strategic urban planning, in the process of running, developing, transforming our cities from 0 to 1? I think this is critical for us to think.
Where do you think the responsibility lies? I mean, going back to the question is we need to have a mind shift in terms of urban planners and practitioners within the cities, or is more the political approach to this urban planning?
I would say it's both. It's both. We have to have a change in culture on the way we do things. We certainly have to have the legal mechanisms, for these for this mainstreaming sometimes to be institutionalized, such as the one I just mentioned for environmental impact assessment. We need to have political leadership, and we just highlighted here some examples of changes for better health and well-being for all happening through political leadership. A very important aspect for us is also the vertical integration, and we need to have all levels of government on board on that, because we know that oftentimes the cities or the metropolitan areas, they do not have the mandate or the resources to put the changes we need in place. So I think we need a composition of these, not to mention, of course, what we just did to build the capacities within the cities, but also at our schools and universities for people to be able to operate under this old new paradigm.
How do you involve communities in this urban planning? And not only about, because I think what you were referring before is not only about consultation. I suppose something else, isn't it?
Yeah, I think there is a lot of room. I mean, I think we should build on the fact that a lot of young people and more people are really behind the changing habits and lifestyles and actually protesting, coming in the street for governments to adapt more to climate change. And I think we can build on that movement. And an example is, for instance, how can we bottom up put the attention to air pollution? And a great example is in Antwerp, in Belgium, where a couple of years ago started a citizen science project, which was the world's largest. I think meanwhile there have been a couple of other ones, where thousands of citizens are involved in measuring air pollution in their street. And this came at a very low cost. It was €10 for equipment to put it on your house, and done in cooperation with a couple of universities. And they received money through crowdfunding. So again, you see that people are interested to do this. And the results have, and the evidence produced by this, give a much more granular picture on air pollution at street level. So this gives data that has never been produced before, and it has compelled and pushed the government to immediately take action. And the other side of the coin is that all the people that participated in this event, 100% of them, they have changed their own habits in terms of mobility, transport, etc. And perhaps another example, which I think is also great, is the tactical urbanism. For instance, in neighborhoods in Bogota, Bolivar, very diverse neighborhood with refugees, immigrants. And it's another sign of our time, I think, that more people are moving and we get a lot of diversity. But people were afraid to come in the street because there was crime, violence, drug trafficking, too many cars. And tactical urbanism, with a low budget, has enabled the opportunity to, in a very short time, transform the street into spaces for people, has allowed these families, refugee families with kids, to use the street to connect with each other and for the kids to play, because the houses in which they live had no or almost no outdoor space. And this has also so build up both the support network of the parents and also enable the kids to play and connect with each other and youth to come into the street. And this let's say quick and cheap project, because it is linked with the city, enables to draw lessons from it and then integrate principles both in policies on public space for the city as well as in social policies. So
both because of your positions and your perspective, you have a global, I think you have the local, but as well the global perspective. Do you think all these discussions, what we've been discussing today, and these examples that you were, and approaches can happen the same way in the global north cities that in the south, global south cities? Or you may think that in the global north there are more resources, so it's easier to introduce the transformations that are needed, or not?
I think absolutely. I mean, the example of the tactical urbanism is one that is also happening in Brazil, for instance, or in the slums in South Africa, working with youth, in fact, providing sports and bringing more people in the street to creating activity hubs, meaning that young men are engaged and less involved in gangs. And that reduces the violence and brings also more young women in the street. So yes, there are examples. I think the governments have limited budgets and have put a lot of budget now in recovery and responses. And so with low budgets, you can go a far way.
Octavi, maybe I can give some two concrete examples of work that we are developing with low and middle income metropolitan areas, both in Accra, Ghana, and Kathmandu and Nepal, where we develop the Urban Health Initiative model process, which is precisely a stepwise approach to see how we can use health to create demand for action across all the sectors. And we have just completed now the first results for Accra, for instance, and what we could see there is that there is a lot of local capacity and data and opportunities and assets that sometimes we don't even see in wealthier environments in Europe, for instance. And it really demands, as I said before, a political leadership, a proper coordination, and the understanding that health could be this driving force, could be at the core of the changes. What we have seen there was leadership from the Accra Metropolitan Assembly and of the Kathmandu Valley municipalities really taking this issue into their hands, going to the communities, facilitating the dialogue with the educational boards, with the local chiefs, with the other sectors, and that has really worked. There's one aspect that is really important in this discussion, which is the fact that oftentimes in these places we have assets that we lost in many rich metropolitan areas. For instance, when it comes to public space, in most of those environments, people still walk. It's not necessarily the safest environment, it's not necessarily clean. We do have to improve those conditions, but people still know how to walk in the urban environment. So how can we tap into these existing assets and protect and promote it further?
Very interesting and a very good point. I'm afraid we're running out of time. I would like just to maybe for both of you to finish with one sentence on some idea you want to share, a final idea, a message that you want to share with all the people that will be watching and listening to us. Elisabeth.
Yes, maybe I just go back to that. I think the overarching agenda should be climate change, because if we don't think of it, there is no human life at all, and we cannot talk about health. So we need to integrate this agenda together with health in urban planning, and we cannot have healthy environments if we don't take into account equity. So available to all, and I would say also gender and diversity.
Thank you, Elisabeth. Thiago.
Octavi, now just end up by thanking the company of Elisabeth. My final message is just to highlight the opportunity that we have even more now with COVID to create urban environments that are much better for everyone across the globe. We passed the stage of convincing people that this is that health and urban environments are connected. Now it's really the time to act, and it's really the time to use the tools that we have and the resources that we have to steer this urban transformation in a direction that promotes health for everyone.
So thank you. So we have arrived to the end of our Metro Talk of today. Thank you, Elisabeth Belpaire, from ISOCARP. Thank you, Thiago Herick de Sa from the World Health Organization. Thank you to our listeners for tuning into this episode of MetroTalks. And if you are looking for more revolutionary ideas on the future of metropolitan spaces, find MetroTalks. You can find MetroTalks on Spotify and Spreaker, or you can subscribe to our Metropolis YouTube channel. And just let me say you that this episode was produced by Laura Valdez from the Metropolis team, and I'm your host, Octavi de la Varga, and we will be back soon with another slice of MetroTalk. Thank you very much for your attention.